Hi, I'm Dr. Chuck Reinertson, or as most of my patients call me, Dr. Chuck. And we have some very, very exciting news in dentistry that we want to share with you. This is information that is actually going to shift the way we look at the mouth, the way we look at ourselves, the way we look at medicine. So we're actually going through a paradigm shift in dentistry and medicine over the next 10, 15 years. And let me explain what a paradigm shift is. I mean, you have to look up the definition. Paradigm shift is a fundamental changes in the basic concepts and experimental practices of a scientific discipline. So when you've looked at something a certain way for a long time, it tends to become, that becomes fact. For centuries, people thought that the earth was flat, and until they went out and proved that it wasn't, they realized that they had to shift their thinking because it doesn't matter what they believe, it matters what's true. And that's the thing we have to look at when it comes to the body. It doesn't matter what we believe. It matters what's true. It matters what actually is happening. And the shift that we're seeing right now is we're actually beginning to connect many of the dots that have been not connected in dentistry and in medicine. So it's kind of exciting. One of the things we have is we have to understand who is responsible for our health. Is it your physician? Is it your dentist? Is it the nurse? Is it the neighbor? Is it your mother, your father? Who is responsible for your health? And what's really tough, and I have to do the exact same thing, is I have to look in the mirror and say, I'm the one who's responsible for my health. The physician can help me. The dentist can help me. The neighbors, the family, all of those can help you, but who's actually responsible? Ourselves. Now, that's not to say that disease doesn't occur, and it does, and bad things happen to good people, and you can do everything right, but we have to look at the overall percentages, and looking at the percentages, if we can take control of our own lives a little bit and realize that our health is up to us, not up to our physician, they can help, they can assist, they can recommend changes, but those changes are up to us. Whether we do them or not, you know, we pay the consequences. One of the things that we're finding here is we're getting back to the basics within the whole body. We have to look at the bloodstream in maybe a different way. I mean, there's a lot of people that yeah, of course we have a bloodstream, and yes, it's coronary artery disease and cardiovascular disease that causes so many problems. We have a bloodstream, but let's look at what that bloodstream does. The bloodstream connects everything within the body, connects every organ, connects the bones, connects your brain, connects your heart, it connects everything. That blood is going through everything. Think of it as the river. Up the stream in the river there's a factory. Now this factory is putting pollutants into the water, and this water is coming down by you, and this is where you get your drinking water. Would you be concerned if that factory was dumping pollutants into that water and you had to live off of that water? Of course you would. Well, we have to see what's happening within the bloodstream, what's happening within the mouth, what's happening, or what are we putting into the bloodstream from the mouth? Is that the biggest polluter of the bloodstream? I believe it is. If we look at the fact that 47%, well, 75% of the population has at least some form of gum disease. 47% has moderate to severe periodontal disease. Well, what is periodontal disease? It's a gum infection. Well, what does gum infection do? Well, it gets down under your gums, destroys the bone, doesn't hurt, does not hurt, but it creates pus. And what is pus? Pus is dead white blood cells, bacteria, and tissue debris. Pus. That's what you have being produced under the gums and is being put into the river of your body, into the bloodstream. What happens when you have a dental infection? The exact same thing. And here's the biggest challenge we have as dentists, because people tend to think if something doesn't hurt, it's okay. You go to the dentist so that you can have the pain taken away. The dentist fixed that. Well, here's the biggest issue we have is that most dental infections never hurt. You don't even know you have them. I can't tell you how many times. In fact, we'll show you x-rays, and you can see the x-rays where people came in for just a regular examination. We looked at this examination. We found big abscesses going on inside of the mouth. Did not bother them. There was no discomfort. In fact, many times we tell them, this has to be taken care of. This is an infection. This is going through your body. And but it doesn't hurt. And so as long as things didn't hurt, people were less likely to get the work done. Now, those that understood that infection is not good for your body would go ahead and do a root canal on the tooth or have the tooth removed, but you've got to get the infection out of that area. So that's one of our challenges, is that dental infections don't hurt. Gum infections rarely hurt until they get really bad. Dental infections of the teeth many times don't hurt. People will talk about they call it a gum boil. I got a gum boil over there, which is a fistula, it's a draining fistula. What's coming out of there? Pus. Where else is that pus going? Well, you're swallowing it. Plus is going directly into the bloodstream through the bone. So it's just because it doesn't hurt doesn't mean it's okay. So this is a real important point, because it's always the other person that's going to have the problem. It's that person. It's never ourselves. Physicians, same issue. As long as it doesn't hurt, many physicians think everything is okay. They're regular people, just like all of us. So we all have to be aware that just because something doesn't hurt doesn't mean everything is okay. Now that includes high blood pressure, diabetes, glaucoma, cancer. Now all of these in the early stages, there's no pain, but eventually it's going to get to you. Trying to let you know the mouth is the exact same thing. You might not have any pain in the beginning, but eventually it's going to get to you. If you look at the statistics, they're really, they're not good. If you have gum disease, you're 65% more likely to get pancreatic cancer. That's a big one. If you have 50% of acute heart attacks are triggered by a dental infection. Now, these are not my statistics. There are hundreds of pages of research that is going into all of this. So this is not just, you know, what does Dr. Chuck happen to think? Because really that doesn't matter. What matters is truth. And we have to delve into this a lot deeper and see how we can help people prevent these issues and recognize these issues so that you don't have the bacteria dumping into your entire body. A good way of illustrating this, and for some it may gross you out, but I'm sorry, because this is what's happening. Since we can't see what's inside the mouth, let's go ahead and just hook an IV up into our arm. And in the bag, in the IV, what we're going to do is fill it full of pus, because that's what's going directly into our bloodstream, into our body from our mouth. It's just that we can't see it. Now, if you can get that image in your mind, an IV with a bag full of pus going into your body, would that be a healthy thought? Absolutely not. So we have to decide, what are we going to do now? And the next thing I'm going to give you 2 recommendations for you to do. Number 1, make sure that your own dental situation is good and healthy. We have our patients, our regular patients, they're healthy. Most of them are healthy. But many times we'll recommend to someone, you've got gum disease, you need periodontal treatment. We can do it non-surgically now, or you have to wait until it's going to be surgical. And a lot of times people say, well, it doesn't hurt, they don't get it done. So who am I talking to? Everybody out there. We've got some patients that are fantastic. Their home care is wonderful, their mouth is great. We've got others that have kind of let it slide because it doesn't hurt. We have others still that are just almost defiant. It's like, well, I'm not going to do that. There's no pain. It doesn't bother me. You know, and why is it so much money? You know, well, let's see what we're doing. You know, by getting down in there, by getting things numbed up, by getting things cleaned up, by helping to prevent some other diseases you have. Tell me, what does one day in the hospital cost? What does a week missed work cost? What does it do to the family? One of the challenges we have, that when people go through the systemic issues from heart attacks, strokes, and things that are actually very preventable if you just take care of your dental situation, and also get some moderate exercise and watch what you eat. I mean, 3 things. It's not that hard. I mean, it's a lot harder to watch what comes out of your mouth than it is what's in your mouth. So if we can just do those 3 things, and that's, you know, watch what you eat a little bit, get a little bit of exercise, half-hour walk a day. More if you want to, and have a healthy mouth. But no, what we have to remember is that when you do have the heart attack, or you do have the stroke, or you do have the debilitating illness that was completely preventable, it doesn't affect just you. It affects your entire family, your spouse, your children. Everybody are affected by what happens to you. So if not for your own sake, for your family's sake, make sure you're healthy. So, and whether you come to us, you see another dentist, we're not trying to if you're happy where you are, wonderful. Just make sure that you're healthy, and that's the number one thing. So, I'm Dr. Chuck Reinertsen, and I hope this was helpful for you. It's really big news. It's a paradigm shift, and we're glad that you're going along the journey with us. Pass this around to your friends. You know, send it out. People need to be aware of just how much their mouth affects the rest of the health of their body. So I'm Dr. Chuck Reinertsen. Have a wonderful day.